actions from the local LGBTQ plus organizations in Center County, Penn State Health announced it will no longer provide gender-affirming care to individuals under 19. It's a move Penn State says comes from an executive order under the Trump administration. Michael Merville has more on how this could impact transgender youth in Pennsylvania and why advocates are calling the decision dangerous. Michael?
Yeah, Jen, Penn State Health has officially changed its policy regarding gender-affirming care and will no longer treat those under the age of 19. For Center County advocacy group Center LGBT+, they say the policy change is harmful for trans youth across the state. The change follows an executive order from President Trump called Protecting Children from Chemical and Surgical Mutilation, giving the federal government broader authority to prevent gender-affirming care to Americans under 19 years old. Before the executive order, Penn State Health did not offer this kind of care to minors under 18. In a statement released by Penn State Health on the matter, they say, quote, Penn State Health is committed to providing care for transgender and gender diverse people in a supportive and safe environment. Center LGBT+, a nonprofit group that advocates for LGBTQ+ rights, says gender-affirming care is medically necessary and can be life-saving. They say the policy change can have a negative impact on transgender and non-binary youth. Officials cite a national study in which they say they found trans youth who are able to access gender-affirming care was associated with a 60% reduction in severe depression and 73% reduction in suicidal thoughts. For one board member at Center LGBT+, she says the overall impact of Penn State Health's policy change goes far beyond healthcare access.
This decision sends a message to trans and non-binary youth that their lives are not valued, that their care is not valued, and they are not welcome within our communities, our Commonwealth, and our nation. This is a time of profound fear and challenge for the transgender community and the queer community broadly, and our trans and our non-binary youth are bearing the brunt of this. And so in this time of increased crisis, to have life-saving medical care ripped away only makes the damage that much worse.
Advocates are urging Penn State Health to reverse this decision, citing the growing uncertainty about the future for transgender youth. Reporting from Center County, Michael Merville, 6 News.